Hello viewers, welcome to my channel BioQuest Biochemistry classes. Today I am back with a video tutorial on anticoagulants. What are anticoagulants? Anticoagulants, commonly described as blood thinner, are substances that prevents or reduces the coagulation of blood, prolonging clotting time. What are the common examples of anticoagulants? Heparin, sodium citrate, EDTA. Now, what are the uses of anticoagulants? They are used as prophylactic measure or in management of coronary artery disease, ischemic stroke, deep vein thrombosis, and it is used in the laboratory to collect plasma samples for some investigations and testing. Let us check each of the anticoagulants that are used in the laboratory with their mechanism of action, uses and disadvantage. To start with heparin, it is the physiological anticoagulant of human system. It is available as sodium, lithium or ammonium salts. It is frequently used in requesting stat or immediate blood chemistry tests, blood ammonia quantification. Heparin activity or concentration is measured in either international units or United States of Pharmacopoeia, abbreviated as USP. This USP unit is defined as the amount of heparin that prevents 1 ml of citrated sheep plasma clotting for 1 hour after addition of 0.2 ml of 1% calcium chloride solution. The recommended anticoagulant for most plasma-borne chemical analyte is lithium heparin at a final heparin concentration of 10 to 30 units per ml. If you check the vial, you can see the units of heparin in the green capped vial is given as USP. How does this heparin act? This heparin activates antithrombin 3, and by binding with antithrombin 3 it causes a conformational change and increases the activity of antithrombin 3 by 1000 times. This antithrombin 3 inhibits the conversion of prothrombin to thrombin, and if thrombin is not formed, fibrinogen won't get converted to fibrin, clot would not be formed. Heparin also inhibits or inactivates acid phosphatase. Heparin is the preferred anticoagulant of choice for arterial blood gas analysis or ABG. Pre-heparinized syringes are ideally used for arterial blood gas analysis. Syringe should be flushed with 0.5 ml of heparin in a ratio of 1:1000 solution and emptied in places where we don't have pre-heparinized syringes. Next anticoagulant is sodium citrate. It is the anticoagulant that is found in the blue capped vial. 3.2% of sodium citrate is used as an anticoagulant. Citrate chelates free calcium ions, inhibiting to form a complex with tissue factor and activated factor 7. Thus inhibits the activation of coagulation factor 10. This inhibits the extrinsic pathway of coagulation. It is routinely used for tests like prothrombin time, derived INR, activated partial thromboplastin time, fibrinogen, fibrin degradation products and D-dimer quantification. 3.8% sodium citrate is used as an anticoagulant for ESR estimation by Westergren method. What are the disadvantages of sodium citrate? It alters the cell morphology, so it cannot be used for complete blood count. Moreover, it inhibits enzyme activity of alkaline phosphatase, AST and ALT. Next anticoagulant is EDTA. Dipotassium or tripotassium salts of EDTA is routinely used. In some places, sodium salts of EDTA are also used. It acts as a chelating agent. It binds to calcium and prevents clot formation. It is effective at a final blood concentration of 1 to 2 mg per ml of blood. EDTA solution of 0.1% can be prepared and used. International Council for Standardization in Hematology recommends the use of dipotassium EDTA due to its less hyperosmolar effect on blood cell compared to tripotassium or K3 EDTA. So, K2 EDTA is the preferred one. Where do we use this EDTA anticoagulant? It is mainly used in the hematology laboratory for routine tests like CBC, hemoglobin, packed cell volume, but also used in biochemistry laboratory for tests like HbA1c, that is glycated hemoglobin estimation, G6PD quantification, interleukin-6 estimation, intact parathyroid hormone quantification, ACTH quantification, plasma renin activity estimation, hemoglobinopathy screening, and DNA extraction. What are the disadvantages of EDTA? It inhibits enzyme like alkaline phosphatase and creatine kinase. Moreover, it is not suitable for quantification of calcium and iron. Next anticoagulant are the oxalates. This may be used as potassium, ammonium, sodium or lithium oxalate as an anticoagulant. They form insoluble complex with calcium ion and precipitate as oxalate salts. Potassium oxalate is used at a concentration of 1 to 2 mg per ml of blood in gray vial. Remember, this is the preferred anticoagulant that is used in gray capped vial for plasma glucose estimation. The combination of ammonium and potassium oxalate in the ratio of 3:2 by weight does not lead to shrinkage of the red blood cells or erythrocytes and is used in packed cell volume estimation. These are double oxalates. Oxalates are also used as an anticoagulant in quantification of ESR by Wintrobe's method. Drawbacks of the potassium oxalate: oxalates inhibit enzyme like acid phosphatase, alkaline phosphatase, amylase and lactate dehydrogenase. Next is fluoride. Please keep it in mind that the primary property of fluoride is it is basically an anti-glycolytic. What does it mean? It inhibits the glycolytic enzyme enolase, which is responsible for dissolution of glucose to 3-carbon pyruvate. It has poor anticoagulant effect. That's why the gray capped vial, which contain both oxalate and fluoride. Oxalate, it is used as an anticoagulant, and fluoride, that is used as an antiglycolytic. It is used in the proportion of 2 mg per ml of blood. It is used in glucose estimation, oral glucose tolerance test, and lactate quantification. Now it's trivia time. Let us check what are the anticoagulants that are used in blood bags for donation. They have citrate phosphate dextrose, that is CPD, citrate phosphate dextrose adenine 1, citrate phosphate double dextrose, and acid citrate dextrose formula A. Now this acid citrate dextrose formula A, this is commonly used in blood bags that are used for blood transfusion or blood donation. They have a capacity of 350 ml routinely. Thank you for watching. If you feel the video useful, do like, share and subscribe. Keep watching.